really work to fill a gap between an underfunded and overburdened public system and an unaffordable private system. And so those are kind of the two, again, like the 50,000 foot view for folks accessing healthcare in the communities and in the countries where we serve, is that they can access it in a public system that's underfunded and overcrowded and doesn't have the resources that it needs to serve the population that it's set up to serve. We're very clear to say this is not the practitioner's fault. Incredibly talented practitioners in that space, and they just don't have access to what they need to continue to provide care on a daily basis for folks. And while in theory, the system is set up for those services to be free, in all actuality, the only thing that's really free is a consultation. Anything beyond that conversation costs people out of their pocket, right? For example, in Uganda, where we work, in one of the communities in Masindi, when we first started there about a decade ago, they would get a formulary delivery every 90 days, and that formulary might last for 15 to 20 days. And so if you came in on the back end of that and needed a prescription drug, you would not have access to it. And so you'd have to go to a retail space to identify that drug, or even identify sutures or whatever it might be for a procedure and bring it back to the facility. And then on the private side, there's a business opportunity. And so where there is an opportunity, businesses pop up, right? And so private care has certainly exists, and there's a platform for that in all the countries where we serve. The problem, and you can find higher quality care there, to be totally honest and transparent. The problem is it's inaccessible for the overwhelming majority of the population. Only about the top 10% of the socioeconomic ladder have the capacity, financial capacity, to access care through that platform. And so we work in the middle of that. We work to serve the least advantaged of our brothers and sisters across the globe with the highest quality. There is a transaction, a small transaction that takes place that allows us to have operational sustainability and gives us the opportunity to continue to provide continuity of care for generations in a community.